Are you debating between buying a back brace and going to physical therapy? You're looking at these two options because your back is killing you. You're not able to move around your house. You're not able to walk the distance that you want to do. You're not able to stand up, sit down. Basically, your back is running your whole life, right? The back pain can be one of those things that just interrupts everything. Anything from standing in the grocery store line to sitting in your car commuting to work can become very difficult and very painful, and sometimes surprisingly quickly. And so if you are staring at the aisle and you're like, back braces are looking pretty good right now, but I don't know if they're going to help me. And then maybe a friend told you about physical therapy, but you know that that's going to be something that you have to commit to, and it's another thing on your list, so you're kind of trying to figure out what makes the most sense for you. Well, let me just kind of go through the benefits of both. Hopefully this helps and doesn't make things more confusing for you. So the back brace. So if you're going to go buy a back brace, which I'm not for or against, I think they have their place. You want one that, especially if it's your lower back that's bothering you, it really needs to start at your mid-hip and then be really tight. So there are some that stay kind of loose, but you have to be able to make it real tight, because the goal of the back brace is to help you stabilize your spine. So if you are bending forward, you don't want that to happen, right? You don't want that. So if I'm up here, you see how there's a curve? If I'm wearing my back brace and I flex forward, I shouldn't be able to do that, which means that it needs to be on your skin, so underneath your clothes. So you're going to be wearing loose shirts for a while. But you want that back brace to be real snug. And they have some that like pull this way and then pull that way and then have extra straps. And they can be very intense. You can buy them on Amazon. They're all sorts of different pricing. And so the benefits is pain management. Oh my goodness, if your spine is unstable and your spine is just moving all over the place, you have herniated discs and things that are crazy going on in there, and you put on a back brace, especially if it's fitted properly, that can take off so much pressure from your low back. It can make it easier for you to move around and get around in your environment. It can help you make it through your work day. They do tend to be a little bit uncomfortable when people wear them correctly. My biggest, especially being here in Houston when it is hot as blazes in the middle of the summer, a lot of people don't like wearing them because of the extra, it's an extra layer, and they can be very hot. But they are beautiful for pain management if you get them fitted correctly and are using them correctly. Now, for physical therapy, what would be the difference? All right. So with a physical therapist, what we do is we look at how you're moving and what your symptoms are. So like, when does your back bother you? How long has it been bothering you? Does it hurt when you're moving forward, when you're standing up straight? So go through all these like questions and just generally when your pain is. See how you're moving. Determine what's tight and what's loose, because normally there's some imbalance that's happening. We're going to check to see how your stomach muscles are and how your back muscles are and how your hip muscles are. So we're going to go through and check all that strength and see if everything's balanced, because ultimately that ends up being the big thing. The big problem is that there's some form of imbalance. If you have this much back pain and things are that unstable, it doesn't necessarily mean you have an overt strength problem. A lot of times we just have a balance problem, like something is pulling harder than something else. And so it's a matter of figuring out what those two items are and then how to make it basically calm down and be equal. And then look at how you move in your environment, because a lot of times we've created some interesting movement patterns because of pain. Maybe it's because of the way that what you have to do for work. I mean, some people have just repetitive motions at work, i.e. sitting for 8 hours a day, that can cause certain things to be tight and certain things to get weak. So just a matter of figuring out how to unravel this, the intricate person that you are and all the things that are involved with you. And so There is specialized exercises that we can give you. There are hands-on techniques to help facilitate all of these things and make sure that they happen quickly, because a general exercise program may be great for some people, but how long does that take? And so if you know exactly which muscles, it's like trying to be precision, right? So if I look at how you're moving, I can give you specific things that are going to help you, not just a general, these are good for backs and these are good for abs and these are good for hips, because sometimes that can just be like buckshot. You're just shooting everything. Whereas when you come to a therapist, we're going to be looking at how you move. We're going to be very specific on what we want to see, and how we want that quality of motion to look. And we're good at getting that to come out so that you can stand at the grocery store, so that you can get back to walking with your friends on, a nice, cool evening, so that you can get back to the vacation planning without fear of having to be on an incredibly long airplane ride and having that just be too much for you. So those are kind of the differences between buying a back brace and having physical therapy. And I hope that information helps you.